hearing these numbers, it's people's sons and daughters and mums and fathers.
176 British Columbians died from an overdose in April, according to the BC Coroner Service. That's about 6 lives lost per day. April marked the 14th month in a row that saw more than 100 suspected illicit drug toxicity deaths in BC.
Those are young lives lost. That really hits me hard, is that they haven't had a chance to even live life yet.
Last month's overdose numbers in BC are a record for the month of April, representing a 43% increase over the number of deaths reported in April 2020. Stephen Hall with Together We Can Addiction Recovery and Education Society says there's not nearly enough treatment beds and services in the province.
Our government could certainly step up a bit more in terms of abstinence-based recovery. So our detox centers, we don't have enough beds. To start with, we don't have enough beds. The second piece is the window of opportunity for somebody who's actually ready to get clean is very small.
Hall has struggled with his own addictions and says the upward trend of overdose numbers has a lot to do with stigma.
What we're seeing a lot of is just miseducation, is people don't understand the process of getting clean, of doing recovery, but they also don't understand what addiction means and what it actually truly means to be in addiction.
Keir MacDonald with the Phoenix Society says during the COVID-19 pandemic, treatment and recovery services have been even more difficult to access.
Access to any resources has had its challenges, whether that was accessing harm reduction services or treatment and recovery services. Those windows for people to seek help or seek a bed, is often fleeting. And so when people now face those extended barriers and delays, that's a key challenge.
And Leslie McBain with Mom Stop the Harm says asking for help in the first place is a struggle many face.
It takes courage to reach out. And when you think you might be met with some kind of negative response or, a response that isn't helpful, it's very difficult.
680 people died from an illicit drug overdose in BC in the first 4 months of this year. To put that into perspective, the same number of COVID-19 related deaths were reported over the same time frame.
The missing piece is a safe, regulated supply of the drugs that people need.
We've seen what can happen through COVID, where you treat, a public health emergency with a significant amount of urgency and investment. I think what we haven't seen here, unfortunately, is either the same urgency or the same investment.
And a reminder for those not ready, not able, or not interested in accessing treatment services.
Things like the Lifeguard app, really important mechanisms to make sure that there are those safety nets around. That at least is there a friend with you or someone you can sort of alert that you'll be using substances.
In Vancouver, Miranda Fatour, City News.